This is an article that came out on cleveland.com, November 21st, 2017. I will leave the link to this article in the description box. Drug, suicide, and alcohol deaths expected to skyrocket in Ohio, report finds. Unless something is done, Ohio could remain at the center of the national opioid plague for the foreseeable future. Drug deaths in the state are expected to rise 70% by 2025, according to a new report. Since 1999, drug deaths in the Buckeye State already have increased 506%. Beyond that, deaths from drugs, suicide, and alcohol combined are projected to climb 47% by 2025 in Ohio and 41% nationwide, according to the report. Pain in the nation, the drug, alcohol, and suicide epidemics, and the need for a national resilience strategy, released today by Trust for Americans Health, a health policy and advocacy organization, and Wellbeing Trust, a mental health foundation. But even those estimates are conservative. At the current rate of heroin, fentanyl, and carfentanil use, death rates would actually double by 2025, the report said. It's time for a paradigm shift. John Auerbach, president and CEO of the Trust for America's Health, said during a conference call. The report calls for approaches that focuses on prevention, early identification, and effective treatment. There is a serious crisis across the nation, and solutions must go way beyond reducing the supply of opioids, other drugs, and alcohol. Greater steps that promote prevention, resiliency, and opportunity must be taken to address the underlying issues of pain, hopelessness, and despair, Auerbach said in a statement. To reduce the opioid deaths, suggestions include adopting responsible opioid prescribing practices, public education about disposal of unused drugs, anti trafficking efforts, and increasing the availability of rescue drugs. As for suicide and alcohol deaths, the report recommends expanding crisis intervention services, promoting anti bullying education in schools, and integrating primary health into primary care, and increasing prices and reducing the hours of alcohol sales, and enforcing underage drinking laws, respectively. Um, Listen to this one. Neither can be jail our way out of the problem. So they're saying don't put anybody in jail. We hear this so many times it's not even funny. Nor can we exclusively treat our way out of the problem, Gupta said during a call. It's amazing. You were all for jail during the crack epidemic, but these same folks, oh, they are against it. Pain in America, Trust for America's Health report predicts drug, suicide, and alcohol deaths will keep rising through 2025. So that tells you right there, they already know this drug plague is going to continue to grow and rise, and there's nothing they can do. They're just anticipating how bad it's going to get. So in 1999, there were 19,128 drug deaths. In 2015, there were 55,403 drug related deaths, and they're projecting by 2025 111,453 drug related deaths. Wow. Okay, you can see is in in the green you can see so much of the country is heavily into the drugs. They can't do anything to stop this, ladies and gentlemen. There's going to be a lot more people than what they're projecting. That's my opinion. I believe it's going to probably be quadruple the number that they're telling us. But please tell me what you think. Please leave your comment and subscribe. And don't forget to hit that notification bell. Peace, family.